Your doctor may recommend a sweat test if you or your child has symptoms of cystic fibrosis, or if your baby has a positive CF newborn screen. CF is diagnosed based on symptoms, genetic testing, and a sweat test. Sweat tests measure the amount of salt in sweat. They are done because people with CF have high levels of salt in their sweat. Specifically, the test measures the amount of one part of salt called chloride. The sweat test is used only to determine whether or not someone has CF. It cannot be used to predict how severe the symptoms of the disease will be. In this video, we will explain the steps involved in the sweat test so you can understand how the sweat test is done. A few things to know before the test. The person getting the test can eat a normal diet on the day of the test, although it helps to drink extra fluids before and during the test. Give infants frequent feedings of breast milk or formula for 24 hours before the test. Do not apply creams or lotions to the skin for 24 hours before the test. There are no needles involved in the sweat test. Sweat tests should be done at CF Foundation accredited care centers where trained technicians follow guidelines for diagnosing CF. This video will show the process followed at CF care centers. The test has 3 steps. Sweat induction, in which a chemical causes sweat glands in the skin to produce sweat. Collection, in which the sweat is collected for analysis. Analysis, in which the sweat is sent to a lab and the chloride content of the sweat is determined.
I think knowing that the sweat test didn't hurt, it definitely reassured me, because when you're looking at this thing, I've never seen something that looks like this in a doctor's appointment, so it was very foreign to me. My understanding is that the sweat test feels kind of like when your foot falls asleep, that tingly sensation, and so it made me feel a lot better knowing that it wasn't hurting them. They might be crying just because it's more uncomfortable, but not because it's actually hurting them.
You're going into this test and you don't know what's going to happen. But really it was like the knowledge that the doctors had about it. They walk you through step by step and kind of let you know exactly the process that they're going to do. And that just really puts you at ease, because obviously they know what they're doing and we did not know what was going to be happening. So just kind of slowing down and taking us through that process really helped put our minds at ease.
First, the technician cleans the skin where the sweat will be collected, usually on the arm or leg. Then the technician sets up a system that will cause the body to sweat. The system includes 2 gel discs, which contain a chemical that causes sweating, and 2 electrodes that carry electricity. The gel discs are inserted into the electrodes, and the electrodes are attached to the skin. Usually 1 electrode goes on the forearm and 1 on the upper arm. A small electrical current is applied for 5 minutes. The current feels warm or tingling, but not like a shock. Although the current is not painful, some infants and children are surprised by the tingling and may become upset or cry. Distracting them with a bottle or toy can help with calming. After 5 minutes, the electrodes are removed and the arm is washed and dried. A sweat collector is placed on the arm. It has a small strap that goes around the arm and looks like a watch. It collects the sweat into a small coiled tube. Sweat is collected for up to 30 minutes. During this time, the process is repeated on the other arm. After enough sweat is collected, or after 30 minutes, sweat is removed from the tube so it can be sent to a lab for analysis. The collector is removed from the arm. Fewer than 1 in 100 patients may have a mild skin reaction to the gel.
Going into the sweat test, once we got done with it, I realized that it was a little bit longer of an appointment than just a normal checkup. So I would say make sure to bring some snacks, some water for yourself, stay hydrated, multiple layers of clothing, because it can be hot, it can be cold in those rooms.
I feel like I had to prepare myself to listen to what the doctors are saying, because when you're so overwhelmed, sometimes you don't hear what people are saying. It just feels like it's going in one ear and out the other, at least for me. So it was nice to have a support system there. Andrew was there to help kind of have both sets of ears to listen to what the doctors were saying so that I wasn't missing anything.
The experience of going into the sweat test, I think initially it was overwhelming. You're going into a new procedure, a new hospital, new care team with the doctors. But when it was all said and done, there was really a lot of relief knowing that everybody there was just there to care for you, care for your child, and make sure that you felt comfortable, the baby was comfortable. So at the end of the day, it was a really positive experience.
Ask your sweat test technician how long it will take to get your results. This varies based on the lab. The test may need to be repeated another day if not enough sweat is collected. If the test results show that salt levels are low, it means that CF is not likely. Some tests show intermediate results. A CF clinician may recommend a repeat sweat test, genetic testing, or both. If the test shows high levels of salt, CF is likely. A CF clinician will meet with you to talk about the results and next steps. Learn more at cff.org/sweat-test.